Mrs. Smith, a 40-year-old patient, attended your clinic today for the first time, complaining of pain from her upper right back teeth and swelling on her face close to her ear. She is medically fit and healthy. She smokes about 15 cigarettes a day and drinks alcohol on the weekends. You examined her and noticed that 1/6 is badly broken and cannot be saved. You proceeded with the extraction, but the crown broke at the gum level and all three roots are still inside. The patient lives in a country town 2 hours away from your practice. Inform the patient about what has happened, address her concerns, and explain further management.
The pointers here would be explain complications during procedure in a clear, concise manner, empathize, logically synthesize the next steps, making it easier for the patient to understand. Referral to the specialist must be offered. Warning about post-op complications must be discussed. Preventative measures for future must also be explained, and ensure that you have consent to proceed. Let's now dive into the role play. All right, Mrs. Smith, are you okay? I will get you to bite on this gauze and I will sit you up. Let's discuss what's been done so far. Are you comfortable?
Yes, I'm okay, but I heard a nasty cracking noise. Is everything okay? Is the tooth out yet?
I completely understand your concern, and these sorts of noises can be very scary, but I do assure you that we are doing our best to give you a very comfortable experience today.
Well, the noises are definitely scary. Can you please tell me what's happening?
Yes, so as we had discussed earlier during the start of the procedure, the tooth is very badly broken down, and as we can see, there is a decay on the x-ray there. So when I was trying to take it out, one of the complications that we had discussed earlier, where the tooth might not come out in one piece, that has happened. So now the bottom part of the tooth, which is the root, is now sitting inside the bone.
Oh, that sounds very scary. Are you sure you'll be able to do it? I'm worried about this procedure.
I completely understand, Mrs. Smith. Don't worry, because I know that this is not easy and the noises can definitely scare you. So I have to take another X-ray now to determine the current position of the tooth and also what's the size of the root that's left inside there. Are you okay with that, Mrs. Smith?
Yes, if that's really necessary, I guess you can go ahead with another X-ray.
Sure. So I have done the X-ray and I really thank you for your patience once again. So it appears that the roots are now within the bone and the root will now need to be taken out surgically. So what that means is that we have to cut the surrounding bone just a little bit and then we have to attempt to take out the remaining bits.
Okay. Will you be able to do this by yourself?
Yes, I am very confident. I am trained to do this. But there are, issues where it may not come out in one piece. So we still have to work through the roots a little bit and take it out. But the other option is we could try to leave it. But I don't suggest we do that because if we leave it, then the source of the infection will still remain inside the bone. So if that happens and if there's a situation where I will not be able to get it out, then I'll have to refer you to see a specialist.
Okay, so you are saying that there is a possibility that the roots won't come out today?
Yes, and that is a possibility, yes.
Okay, so in this case, how do we proceed? What do we do next?
So in that case, what we can do is I'll clean up the site and I'll put you on antibiotics to prevent worsening of infection, and then we'll ensure adequate pain relief as well. Then I will also prepare and send an urgent referral to the oral surgeon and we'll keep you informed. But there are some things that you must keep in mind while we're waiting to see the oral surgeon. If you notice any worsening of symptoms like severe pain, fever, swelling, or difficulty breathing or difficulty swallowing, you must go and see the emergency department immediately. If you are not comfortable with having this procedure done here today, even at this stage, I'm happy to offer you a specialist referral straight away.
And how soon will I be able to see this specialist after you give me a referral?
It's very hard to pinpoint the exact timelines, but we'll do our best to arrange for an early appointment.
Okay, this is all a little too much to digest now that I'm already on the chair. So how do you suggest we move forward?
I completely agree with you. And like I said, it's one of these situations are always they come unexpected, but they are a part of the complications that we expect from the teeth which have so badly broken down. So what I suggest that we do today is let's proceed with retrieving the roots out first. And if that does not work out, as we have discussed earlier, I can always organize a referral to the specialist.
Okay. Are there any other precautions I need to be aware of?
So after today, regardless of whether or not the procedure is complete, it's very important that you follow strict oral hygiene measures, and you must avoid smoking and alcohol until the procedure is complete and healing has occurred. I would also suggest try going on a soft diet, preferably at a room temperature. Because you're now, and I don't want you to burn yourself. And once we reach the stage where the procedure is complete, everything's healed. At a later stage, we must discuss some replacement options, and also we should make sure that you're scheduling regular appointments to be preventing situations like this from recurring again.
Okay, sounds like a plan. I'll definitely, be more aware of my hygiene, and I really don't want to be in this space again.
Absolutely. Now, I hope you've understood everything that we've discussed so far, Mrs. Smith. Do you have any other questions for me?
Not really. I know tilth has been quite tricky since the beginning. I think I'm fine.
Absolutely. No, I understand. So, are you okay with us to continue with the procedure?
Yes, let's do this.
All right, let me lie you back and we'll just take it back from where we've started. Okay?
Okay.